Okay, we are back and live, and this was not theater. This was actually live, interprofessional teamwork that actually made this happen. And of course, the dean was actually the least helpful of anybody. But having said that, you can see how that teamwork really worked. So we had somebody from Central AV, we had our IT person, we had Bhavna actually, and I want to mention Bhavna has really been supporting us. As many of you know, Sarah LaFay left and went to some greener pastures, maybe, but actually to add to her education, and she's doing an MPH program, and Bhavna has really been helping us and pulling everything together. I know you've had a lot of emails, so let's really thank her for all of her amazing work. So we're really thrilled to have her helping our team. But again, as you saw in the theater and as you saw as what came after, you know, it was all really planned, right? That it just takes teamwork and things can get done. But of course, it really takes everybody working together, and it takes empathy, it takes ways to do conflict resolution and be able to come to positive outcomes and be able to walk away from that. And then I think even the conversation and the comments that all of you made, it really takes a focus on the patient and their family and caregivers and thinking about all of that. And as we talk about a lot, I'm teaching a class at the Newark High School. Many of the faculty that you'll see here today are teaching in that class as well, and in our classes at UD. I know Rita Landgraf is speaking about this a lot, and she will have a launch of her Healthy Community Partnership next week on October 30th, and Biden will be here for that. We talk a lot about the health of individuals, and an important piece of that is the social determinants of health. So a small percentage is actually your medical care, a small percentage is your genetics, and a large part of it is your environment, your behavior, all of those other pieces. So the things that you're going to talk about today are the things that really make a difference. They're the things that inspire your patients, help them to understand what's happening, connect them to family members and resources, and all of that makes a huge, huge difference. And that work is harder to do in a lot of ways than we almost think it would be. So I think this is a great opportunity. This will be a very, very important session, and hopefully you will take a lot away from it. So healthcare theater this morning, that's really a product of work that we do in the college as well as with our collaboration with theater. And it really is a piece of interprofessional education that goes completely across the college and actually across the university. And you're going to hear more about that from our great experts today. So Barrett being one of those, and that you already met, and you'll see him again multiple times today, and then Michael McKinsey as well. And so you can see what the agenda is for today. Again, talking about interprofessional conflict resolution, something probably none of you have to deal with, right? Yeah, no, I think maybe. Communicating with empathy, and of course then opportunity to really do discussions and wrap-ups and think about, so how do you take what you learned today and really take that back to your practices? Very important work. Also, just want to mention, of course, that we have no financial conflicts. Everybody who's presenting is poor. No. They're within an academic system, so we're not making a whole lot of money on this. And we don't have any conflicts. And then, of course, how many of you are getting actually education credits for this? So be sure that you fill out, there's an evaluation sheet, but on the back of the evaluation sheet is a piece that you need to fill out in order to get the credits. So then I just want to spend just a little bit of time talking to you about some things that have happened, and you may already be fully aware of this, but I wanted to just take a little bit of time to talk about it. So you have probably seen announcements from the state, Department of Health and Social Services, about a number of summits that have been happening across the state, and they are really focused on moving forward very, very quickly quickly as we can, to a value-based payment model. So when the decision was made by the Secretary Kara Walker, to really focus on value-based payments, some of that coming from the federal level as well as the state level, really trying to get to, how do we get higher quality care at a lower cost and really ensure that we can sustain in a model of healthcare. And so with that, won't surprise you, became the need to have funding to be available to actually support those initiatives. And so the state made the decision that they would actually discontinue or actually end some of the programs that we had put into place as a part of the grant because of this need to turn quickly and really focus on value-based payments. So they really needed to redirect their funds into value-based payments. So the program that we are offering today, we had a whole series of modules that we were planning to present to you, and unfortunately our funding has ended. So our contract has ended. It ended a couple days ago, and we were really intent on still presenting to you one of these modules because we thought it was really important. We have really appreciated our engagement with you up to this point, and we hope to continue to engage with you in the future, but it won't be through the state contract and through those particular routes. One of the things we will be continuing to do work in workforce development. It is what we do as a college. So we do research, education, and clinical care through our clinics. And so we have a lot of opportunities through our amazing faculty, through our connections with clinical partners, and through the wonderful space that we have on the STAR campus, that we will be having a lot of programs and symposium and workshops and all of that. So what I've asked them to do, they will put a piece of paper on each of your tables, but certainly if you don't see it, please go up to the desk. Please sign up if you want us to, Bhavna's bringing those out now. Please sign up if you want to receive emails from us about some of the presentations and workshops and things like that we will be doing. Again, our focus in the college is really training healthcare professionals, and the more that we can actually mix that group with current healthcare professionals, I think it's better for our students, and then you have an opportunity really free of charge to come to these various events. But I know how much everybody is barraged by emails, and so I don't want to be sending you emails about seminars and everything that we're doing if you're really just not interested. So we'd love to have you at any of our events. If there are other people in your teams, in your groups, or you know of others that would be interested, please tell them about what we're doing. You are always welcome and invited. Part of the incentive and part of the drive in our build-out of the STAR campus is really to create more and more interactions between the university and the community, and have the community also drive and focus us on what we should be doing to raise and improve health outcomes for the state. So we're really, really thrilled by everything. So again, I think that probably finishes my remarks, and I think then back up next is Barrett. Okay, so thank you very much for being here today, and we really appreciate your participation.
Well, many thanks to you, Kathy, for that excellent introduction and for getting us up to speed on where we stand with all this. Of course I would do that, right? This is my own little clicker, too. Okay, there we go. So this is Module 3, Interprofessional Collaborative Practice, also known Interprofessional Practice. So I'm going to give you, as the agenda says, a little bit of a blurb on interprofessional education and interprofessional collaborative practice, and then we'll move on to Mike's work in conflict resolution and conflict management. These slides will all be made available. I'm looking for Bhavna, but I'm sure they will be. So you'll see... They already have them. There you go. So we're already right there. So you'll see a series of citations that are included in a number of the sites. If you need any information on those, please feel free to contact myself or Bhavna or Mike, and we'll get more of those for you. So a quick background on myself. Again, Barrett Michaelek, that's my name, Associate Dean of Interprofessional Education. I'm also the Director of the Center for Interprofessional Development, Education, and Research. That's weird echo right there. I'm also an Associate Professor of Sociology. That's my background, that's my discipline. A majority of my work is actually in empathy within the health professions, and also interpersonal connections within the healthcare workforce. So doctor-patient relations, as well as nurse and doctor relations and other providers' interactions. So this is where a lot of my work comes to kind of fruition. I'm also an adjunct assistant research professor over at Thomas Jefferson University. So I do a lot of help with their interprofessional education center as well. So I apologize for all the words. This is rule number 1 with PowerPoint. Don't put a lot of words on the slide. And I've already broken it 3 slides in. But, and also I walk around a lot, so I apologize if I cause any motion sickness, but it's kind of how I have to do things. So some of you, how many of you are familiar with interprofessional education and interprofessional practice? Yeah, a lot of people are, right? This is not new. This has been around for about 20 years, but it's really now in the last, a little bit more than 20 years actually, really in the last 5 to 10 years, gained a lot of attention for a number of reasons, and that's what we're going to go over today. But to give you a little background on the conceptualization of what these are, interprofessional education is when 2 or more health or social care professions, interestingly enough, that social care part was recently added. That wasn't always there. So that's really important. 2 or more health and social care professions learn with, from, and about each other to enable collaboration and improved health outcomes. The type of educational programs that can exist can be anywhere from a day to a couple hours, something like this, to all the way into all the way through the full thing of education for nursing, for doctors, for PT, OT, all those things, health coaches, all that stuff. Interprofessional collaborative practice, and this is a big one, and I'm going to go over it a little bit, occurs when multiple providers, staff, students, and residents from different professional backgrounds provide comprehensive health and social care services by working with patients, their families, carers, caregivers, and communities to deliver the highest quality of care across settings. That is a lot to digest in a definition and a conceptualization. There are a lot of players that are involved in interprofessional collaborative practice, right? So a lot of people at the table, but the goal, and that includes patients and their families as well as their caregivers, right? So a lot of people to work with, all right? And so the things that we're talking about are teamwork, collaboration, those types of things. So why do we care about it? Why does it matter? Well, a number of things at the more kind of higher level. The Institute of Health Improvement, the IHI, the Triple Aim, I'm sure you all have heard about that, right? That's no new thing. Improving experience of care, improving health of populations, reducing costs. Those are all big parts, and collaborative practice has been shown to actually impact those in a positive way. What's new and where the research is now going because of this big talk about burnout, all right, has now turned towards the quadruple aim, which is actually improving the well-being of healthcare providers. And collaborative practice has also been shown to do that as well, which I'll show you in a little bit. Institute of Medicine has putting out calls and alarms since the 70s about the value of collaborative practice, right? And we know now that we exist in this value-based model where reimbursement is tied to savings, quality measures, service, and even patient satisfaction. And collaborative practice has been shown to actually improve those. So it actually has a bottom line element to it as well. We have an aging population, which I'm sure your practices have all seen, increasing in dual diagnosis, complexity of patients, right? All of these things, nothing new here, but this is where collaborative practice comes in. We've been kind of fragmented in our way of doing things in terms of providing care. The continuity of care has been broken up. So now this idea of interprofessional collaborative practice working together in teams has been the new push. This is the WHO, World Health Organization, kind of way of showing how this can happen, from interprofessional education to interprofessional practice. So moving in this direction here, we see a little break. They're showing a little break. This is from 2010. This break is still there. People are actually saying there's a big break here too. We need to rethink the IPE. And this is where we are now, really embracing that collaborative practice. But the question is, how do we get there? Right? Every practice has its own elements, its own culture. And so we need to start addressing those things and how they work together. What are some barriers to interprofessional practice? And I'm sure you all engage or have run up against these barriers a number of times. Institutional and professional culture. So the own culture that exists within your practice. Territory claims, who does what, who owns what. We saw a lot of that in that scenario there. Occupational status hierarchy. Who believes they have more power within the practice based upon kind of social norms and expectations. stereotypes and anticipatory socialization. It's been shown that even students before they get into interprofessional education actually have preconceived notions and expectations of each of the professions before they practice, which can be a barrier towards collaboration. A lack of trust and trust falls, right? Being able to hand off work, those handoffs in terms of agreeing that everyone can do the job, and a lack of acknowledgement of professional roles. Do you actually know, the people that within your practice, what their roles are, what their responsibilities are, where they might blur into your own? That's something we actually fall against. And communication skills. And a lot of that is what we're going to be talking about today. And again, how do we get there? So one of the starting points and where a lot of institutions and organizations are starting to go is taking the interprofessional competencies that IPEC is running with. Right? And that's an international organization for interprofessional education. And we're going to take these ideas and we're going to move them down. We're going to filter them through at their most fundamental level. University of Delaware is doing that now with our own interprofessional education programs, but a lot of institutions are doing that as well. These are the core competencies. We all exist in this kind of competency model now with education, right? These are the core competencies that everyone seems to be following along with. Work with individuals of other professions to maintain a climate of mutual respect and share values. Use the knowledge of one's own role and those of other professions to appropriately assess and address healthcare needs of patients. Communicate with patients, families, communities, and professionals in health and other fields in a responsive and responsible manner that supports a team approach. Apply relationship-building values and the principles of team dynamics to perform effectively in different team roles. These now have each of those competencies have 10 sub-competencies, but these are the fundamental ones that everyone's running with. Now, how do we actually instill them in a practice? This is how people are suggesting we do it. That's very confusing. All right, that's taking into everything. I mean, look at it. You have the system factors, the micro level. I mean, this is as a sociologist, I'm like, oh, yes, yes. That's how we have to see things. But as someone who actually has to apply this, this can be very challenging, right? This is just too much. And this is where it is. It's up here. We need to start bringing it, not saying down here in a negative way, but we need to start boiling it down, drilling it down to its fundamental levels so we can apply it to our own practices, right? But this is where everyone's existing. So how do we do that? Well, I say you take it through a filter and you break it down. These are the competencies at their most fundamental level. Maintain a climate of mutual respect and shared values. Knowledge of one's own role and those of other professions, so knowledge and mutual respect. Communicate with patients, so communication skills. Apply relationship-building values. Those are those competencies at their most fundamental level, and we can engage in these. These are teachable, right? You take those are fundamentals, and we can engage in them, we can practice them, we can learn them and continue to practice them, right? So using the fundamentals of the competencies as scaffolding, we're going to kind of build our own practices with these fundamentals. So we're going to focus on empathic communication and empathy, conflict style, assertiveness, managing complex change, civility, psychological safety, and leadership. These all sound a little touchy-feely, right? Whenever I talk to kind of clinicians and practitioners, they're like, yeah, that's great, but come on, these are soft skills, right? Oh, if there's like a dirty word that I cannot stand, it is soft skills. Oh my goodness. These are essential, right? These are essential skills. And everyone says, well, I can do this. Well, the studies show that you're not doing it, right? That these are actually, and maybe you as an individual are, but as an entirety in general, these are not happening, right? These types of quote unquote soft skills that we all have to relearn. So this is the goal now, is to take these elements and use them to build to that professional practice. Right, so the next module that we did have on the books was going to be teamwork and team-based care, which is very much related to interprofessional collaborative practice. Here, what we were going to do and what we are continuing to do is provide those fundamental ingredients to getting there. All right? Today, we're focusing on empathy and empathic communication. Mike's going to talk about conflict style and conflict resolution. The question, again, when we talk about these types of things, they may seem a little like, I don't know, it seems like something everyone can do. Interesting enough, the research continues to show that these elements, empathic communication, empathy, conflict resolution, collaborative practice, lend to these positive outcomes. Less medical errors within practices, better patient outcomes, health, mental and physical health, more satisfaction with work in terms of providers, better work environment, more efficient care delivery, Higher satisfaction with care in terms of patients, less malpractice suits, saves the practice money in a number of ways, less rates of burnout amongst providers, and higher patient compliance with providers, ideas, orders, right? These are all, it's all in the research. I put some citations there for you, not in this particular slide, but in others, so you can go, you can check my work, right? But these are things that we're finding, so why aren't we doing them? That's what we're going to talk about today.